Yeah, welcome to the second ADR flagship dataset briefing webinar. As we know, we're going to be talking about the ECHILD dataset today, and Katie has very kindly come alongside Milagros from the ECHILD team, and she's going to give you all of the info that you need about the dataset. But before I do delve into that, I'll just very quickly want to just give you a quick overview of the ADR UK Research Fellowship funding opportunity for 2025. A few key things that we're looking at here. So we want to unlock policy impact by enabling research that addresses real world challenges using the ADR flagship datasets. We want to ensure trusted, high quality evidence is brought out through these datasets that's underpinned by the flagship dataset framework. We also want to empower new users with guidance and resources so that you can confidently work with the datasets. And this is open to all researchers at all career stages, and obviously successful applicants will need to become accredited via the Digital Economy Act. And we want to build on the previous successes of past fellows, and want to amplify the outcomes that create lasting benefit for policy and society. Really, it's all about inspiring the use of ADR flagship dataset and to drive research that benefits society. So why are these flagship dataset briefings important? Well, they'll help you understand the scope of the funding opportunity, which is centred on ADR England flagship datasets. And really, we want you to be able to discover the unique research opportunities that each dataset offers. And part of that is allowing you to get practical insights that will help you shape strong, feasible research agendas. And this will give you the opportunity to engage with data experts and partners who can actually answer your questions. So speaking of questions, we do have a Q&A function at the top of the screen. So please do post your questions in there, and hopefully we'll have an opportunity towards the end to dip into those and ask and have answered some of those questions. Anything that we can't answer during the webinar, we will of course compile these and publish them alongside the recording of the event and the slides on our flagship dataset webpage. So, as I said, thank you, Katie, for coming along, and Professor Katie Harron, who is a Professor of Statistics and Data Science at the UCL Institute of Child Health, and Katie's also the primary investigator for the ECHILD flagship dataset. So, Katie, I hope you have your slides ready to go. So, without further ado, if I could pass over to you. Thank you very much.
Thank you, Steve. Can you see the slides okay?
Yeah.
Great. Okay. Right, so I'm going to talk about the data to start with. So ECHILD brings together two main sources of data: information on all interactions with healthcare hospital services, so through hospital episode statistics, or HES. So that includes inpatient, outpatient, emergency department data, with information from all children attending state schools in England that's included in the National Pupil Database, which comes from the Department for Education. It's de-identified data, so the linkage has been conducted by NHS England, and it's all stored on the RNS Secure Research Service. And in ECHILD, we've got data for over 20 million individuals, and depending on when they're born, we can follow some of the cohorts up all the way from birth to age into young adulthood, to age 38 for the oldest cohorts. So ECHILD contains information on children who were born since September 1984 onwards currently. So it gives us a huge amount of longitudinal information and lots of rich detail on both health, education and children's social care, which is captured in the NPD. More recently, we've had linkage of additional data sets from health, which include the maternity services dataset, birth notifications and registrations, mental health services data, and the community services dataset, which includes information about health visiting. We've also got a mother-baby link for around 8 million mother-baby pairs, which allows us to bring together information about biological mothers and their children and siblings of the children through the mother-baby link. So that allows us to look all the way back through the maternal health and education records to understand how factors affecting the mother might also influence the child and the child's trajectories. So to put this a bit more visually, we might have information from health from a child who was born, then they had an A&E visit, they were admitted as an inpatient, then they might have had an asthma diagnosis that's recorded in hospital data. Later on, as they reach adolescence, we can pick up things like admissions for self-harm, outpatient appointments, so we can build up this longitudinal picture of interactions with services. And we can do the same within educational data. We know when a child enters school, if they've had support through special educational needs provision. We can look at absences, attainment and exclusions. We also have socio-demographic indicators like free school meals. And in the social care data, we can look at referrals to social care services, whether the child's whether there's any action taken as a result of that referral, and yeah, again, across childhood. But the value of ECHILD is that it brings all of this information together for the first time so that we can look at not just these different interactions within services, but how children interact across different services and how these interactions might influence each other and outcomes. An update on the most recent data that we've got at the moment. So ECHILD's been through several iterations already. The latest one was a refresh of all of the linkage between HES and NPD for children born since 1984, so around 21 million pupils. That was completed in the summer of 2023, and NHS England were able to link over 99% of the pupil of the unique pupils in NPD with their master patient service, so with a health record. Opt-outs are applied on top of the linkage currently, and that will affect different groups in different ways. So overall it's about 5%, but depending on age groups and geography and ethnicity, there's quite a lot of variation, so that's something to keep in mind. As I've said, we've got linkage to maternal records for about 8 million mothers, which means that we've got additional information on the mothers who were born before 1984 who aren't ECHILD cohort members themselves. But mothers born before 1984 wouldn't be captured in the NPD, so that's just the health data. The data are ingested to the ONS Secure Research Service, the SRS. It's highly complex data. There are currently 724 tables within ECHILD, more than 3 billion rows of data, and this gives us more than 350 million person years of follow-up. So there's a lot of complexity to get your head around because of the various component data sets. Most of the data currently go up to 2023. There's an update that's being planned currently, and NHSE are hopeful that we will that they will be able to complete that in spring of next year. So that would give us educational data until the end of 2025, and the most recent available health data on top of that. This diagram here shows you a little bit about how the data is structured. So the education and social care data on the left-hand side in yellow, we've got school level data, so school characteristics. We've got pupil characteristics, so for each year we've got a school census at the pupil level. which contains information about free school meals, demographic details, ethnicity, EDACI, which is a measure of deprivation, and other characteristics. The earliest data that we've got that we capture on children in the education data is the early years census. We also have pupil referral unit census and alternative provision census. And then for each stage of education, we have attainment measures starting at the early years foundation stage profile all the way up to key stage 5, and then beyond that within the ILR. And as I said, absences and exclusions data as well. And then for the social care data, we've got the children looked after return and the child in need census. This pseudonymized bridging file allows you to link the APMR, the anonymized pupil matching reference, with the token person ID, the TPI, within the health data. And then that allows you to link across to information on attendances at outpatients, A&E, inpatient data, critical care for adults, the mental health services data. There are 3 versions of that over time, information on births and information on community services dataset, mortality, and then the mother baby link on top of this. The best place to go to start to get your head around all of these data is the data resources page of our website. The website's www.echild.ac.uk, and one of the drop-down menus is data resources. So here you can see we've got a user guide, which gives you an explanation of an overview of the data that are included in ECHILD. We've got the data catalogue, which is an Excel file that details all of the different tables and all of the variables that are contained within those tables, so that you can really understand whether what we capture in ECHILD is going to help you answer your research questions. We've got an ECHILD training course, how-to guides, data resource profiles, a phenotype code list repository, a GitHub page, including a discussion forum, and then a couple of extra useful resources there. So I'll go through some of these here. This is the user guide, which is accessible through docs.echild.ac.uk. So this gives you an overview and some more information on the coverage of the data in terms of timelines of each of the individual data sets. So that looks something like this. You can see, for example, the A&E data started in 2007 and then finished in 2020, and then were taken over by the emergency care services dataset. And you can see how the different data sets overlap according to this. So this is a useful place to start when you're planning your study, to understand how you're going to create your cohort, what cut of the data you need, what data years you might need, because when you apply to use the data, you will be requesting the table that you're interested in and the year for which you're interested in that table. So you need to understand, how far back do I need to go with my cohort? And if I'm interested in a cohort of births born from, say, 2002 to 2020, how long am I going to be able to follow those individuals up? So this is a good place to start for that. This is a extract from the data catalogue. The contents page here lists the main tables, and then within that we break down the individual elements of those tables, and this also includes information on the years available. So you can click through each of these sheet names, and that will take you to another tab, which then specifies all of the variables that are available, and it gives you a description of those. We've published a number of cohort or data resource profiles, which give you more specific information on the component data sets. So there's one of these for the child in need census, there's one for the mother baby link, there's one for the children looked after return, there's one for the MPD, one for HERS APC, and one that describes linkage of siblings. So they're useful resources to go to as well. The phenotype code list repository at code.echild.ac.uk is a really valuable place for learning from what other people have done and what has been published in the literature when you want to create phenotypes or groups of characteristics of individuals, mostly for the health data, but could be applied to the MPD as well. So you can see along the side here, we've got code lists for chronic health conditions, medical complexity, life-limiting conditions, stress-related presentations, adversity-related injuries, and so on. So these are basically lists of ICD-10 codes, usually, sometimes procedural codes, OPCS codes in HES, that have been curated and published in other in papers, in published papers for particular studies. So you can take these code lists and build on them, tweak them for your particular analysis question, see what other people have done and build on that, and not have to start from scratch when you're thinking about some of these conditions. This will be maintained, this code list repository, and as you all start to use ECHILD and start to come up with your own code list, then we hope that they will also contribute to this, this library. Okay, the next thing I want to talk about is the research priorities. So when we put ECHILD together, we did a lot of stakeholder engagement group and came up with a list of research priorities and broad areas that were felt that ECHILD could make a valuable contribution. And in order to use the ECHILD data, you need to demonstrate that your research question falls under one of these categories. So our first one is informing preventative strategies by healthcare, social care and education services. So for example, we might be interested in the impact of attending a special school compared to a mainstream school on emergency hospital admission rates. We might want to look at the impact of policy changes, for example, on Healthy Start vouchers, and see whether that has impacted on child's health and development outcomes. One of the recent pieces of work that's been done using ECHILD was looking at the effect of the two-child limit on benefits and whether that made a difference in terms of the early years foundation stage profile, the school readiness measure. So that's a nice example of how policy changes have been evaluated. The second area is informing children and their parents. So because we've got such long-term follow-up, and because we capture such a huge amount of the population, we've really got a lot more statistical power and opportunity than we've had previously to be able to look at longer term outcomes across health and education. And this information is really important to children and families. So we might be interested in what the long-term health outcomes for care leavers, what are the long-term health outcomes for children who receive SEND provision, or we might want to see what are the long-term educational outcomes of particular rare diseases, for example. The third area is informing clinical and educational practice. So, for example, we might ask what's the optimal time for liver transplantation based on educational outcomes for children with liver disease. We might be interested in whether treatment for childhood cancer affects cognitive ability or mental health conditions in the longer term. Fourthly, identifying groups who could benefit from intervention. So some examples here: what are the trajectories of unaccompanied asylum seekers through social care and health systems? What are the early health, education and social care patterns of children who develop mental disorders later in adulthood? So some of these questions are being addressed by current research, but the broad research areas are relevant in terms of what you can apply to use the data for. And then the final group of questions there is around using the data in more efficient ways. So understanding the most effective methods for working with linked health and education data. So because of the complexity of the data, and because it is admin data, by its nature, it's messy, and we need to think carefully about how to use it to answer questions that that will be policy relevant. So having an exploratory part of your study to understand the data in itself is always going to be a good idea. So the questions you might examples of questions that would fall under this category are whether there are optimal ways of selecting control or comparison groups, or whether we can how we can account for clustering of health conditions within families. In terms of research priorities, the other relevant group to think about is the community catalyst for children at risk of poor outcomes. This is an ADR initiative, which is a 2-year programme of networking and information sharing to foster closer connections between researchers, practitioners and policymakers. So its focus is on children's social care research. And through this work, we've developed a research agenda which specifically looks at children involved in social care services and the research gaps and the areas that should be prioritised. So you can read that research agenda if you follow this QR link. But the overarching research agenda aims to deliver cross-sector evidence about children's pathways through services and outcomes, and accelerate the use of flagship datasets, including ECHILD, and to continue to develop these datasets so that they can be used. The 10 key topics that came up in the research agenda are listed here. So early help in children in need, household level hardship, family mental health, special educational needs and disabilities, school disengagement, services and workforce, dual system involvement and domestic violence and abuse, minority groups and extrafamilial harms, and then a separate theme on evaluation. So it's definitely worth looking at this research agenda if you've got an interest in children's social care. If you want to find out what has been done using ECHILD already, through our website you can see all publications that have been generated through ECHILD. It's searchable, so you can search by keywords or by authors, and this would be a good place to start if you're thinking about a study and you don't know whether anybody else has proposed it or done any related work. But if you want to find out more about some specific pieces of work that are going on at the moment using ECHILD or that have been completed, there's 2 seminars available on the website if you go to the events section that give lots of examples of the research that's been going on in more detail than we've got time for today. So I definitely recommend to have a look at these 2 in particular, but there's lots of other recordings on there as well. So in terms of accessing the data, as I've said, are held on the ONS SRS. At the moment, applications to link in any additional data on the individual level aren't currently being considered. NHS England and Department for Education are currently working on a new data sharing model which will allow additional linkages to be requested, but that's not live at the moment. You can link in geographical level information. So we have had some users who've ingested sort of area level information to add context to what's available in ECHILD. In order to be able to access the data, you need to be an accredited researcher, which is a status that you can get through the ONS. Your organisation needs to have AOC, Assured Organisational Connectivity, or you can access through a SafePod. And then the process is to apply for UCL. To UCL for initial approval. The ECHILD team at UCL will help you understand whether your proposal is feasible, whether its purposes fit within our permissions, and let you know any specifics about the data that you might need to consider in your application. And then once it's approved by the UCL team, it'll be you can then submit to PASS, and it will be reviewed by the ONS Research Accreditation Panel. Once it's approved by ONS, you'll need to sign a sub-license agreement with UCL. This can be a lengthy process depending on whether you know who the right people in your organisation are to sign contracts and how efficient that process is. Sometimes it can take a couple of weeks, other times it's taken a few months, so that's something to be aware of and to think about early on. And then ONS for approved projects will provide you with a new data share, and data minimisation will occur on a project-specific basis. So you request which specific ECHILD tables you need for your particular analysis, and then that's made available to you. Trying to think if there's anything else that I've missed there on that data access process, but if I have, then I can answer questions at the end. In terms of support, once you have access, there's an ECHILD training course, there's how-to guides, and then the GitHub discussion board. So the ECHILD training course, at the moment, this is on demand through Instats, so you can access a virtual version of the course and all the course material. We are planning to run another in-person training course, which is likely to be in September next year, and that'll be a 2-day course. We've also got some excellent how-to guides, which were put together by Matt J at UCL. And he has written a dummies guide basically to starting your analysis, including all of the data management that you need to begin with in order to get all the complex data across all the different tables that you might have access to in a format that's going to be analysis ready. So that's a very good place to start. And then we also have this discussion board on GitHub, which is where you can post any questions you have about the data, either the data availability or any issues that you're having with particular data sets. And as more and more people start to use ECHILD, there'll be more and more ways that we can learn from each other. So at the moment, we've got a lot of expertise within UCL because we've been using the data for a long time, but that expertise will expand. And yeah, it's a good community so that we can efficiently overcome issues. And then just a note to say that ECHILD is a team effort. We've got an amazing group of people at UCL working on ECHILD who are there to help answer any questions you have. And of course, our data providers and funders. And I think that's it for me. Okay, so happy to take any questions.
Brilliant. Thank you, Katie. That was a whistle-stop tour, but very detailed in places. And there's plenty of as I think everyone can see, plenty of support available for any potential users. So, yeah, I think we can probably have a quick look at some of the questions that have come through. So there are a couple in the Q&A here around sibling information. So one colleague is asking whether the sibling information is only available via maternity services data, and perhaps linked to that as well is another question. Does the maternal link mean that siblings can be identified in the social care data?
Yeah, okay. So the way the mother-baby link works is we use the hospital inpatient data to find a delivery for a mother and a birth episode for the baby, and then we link those together at the point of that delivery. So the spine for the mother-baby linkage, if you want to call it that, is based on hospital data. So the answer to the first question about maternity services data is no, it doesn't rely on the maternity services data. That's a more recent data set that's only really got decent coverage from 2018-19 onwards. But the mother-baby link goes back to 97, which is the start of HES, and is most reliable from 2002 onwards, which is when when NHS numbers for babies came in, which makes the linkage more reliable. And then in terms of siblings, so if the mother has more than one birth that's captured in HES, then we can link the child's records within HES from that, and then we can link that child or those siblings to social care data. So yes, you could find siblings in social care data. The caveat to that is, I'm sure Nikki knows this, but it's useful for everyone else to hear that in the social care data, we can only link children to their MPD record when they reach school age. So children who have been in contact with social care services before the age of around 5 at school entry can't be linked to the MPD. So we can't identify that group of children who only have social care interactions before age 5. If a child has social care contact before age 5, and then that continues past the age of school, we would be able to link their data, including their preschool data. But it's only, that's the caveat with that. So yes, I think the answer to the question is yes, although nobody has looked at siblings within social care data, as far as I know, up until now. But theoretically, it should be possible.
Brilliant, thank you. And I'm just flicking between the chat and the Q&A, but there is a quick one there. What is the oldest cohort of babies with the mother-baby link?
The oldest cohort of babies would be those born in 97, but as I've said, the longitudinal linkage within HES itself over time is less reliable in the early years of HES from 97 to around 2002. So yeah, sometime after that.
Brilliant, brilliant. And I'm just running through, picking some out at random. But if you see any, Katie, that you can answer straight away, please do chime in. One more in the Q&A. Someone's interested in children that are not regarded as SEN but have absences due to illness, yet seen as persistent absentees without any acknowledgement to them having illness. So is this recorded by head teachers and hence subjective? How could this person explore that?
Yes, so absenteeism or school absences are recorded irrespective of SEN, and would be submitted by the school. I'm not sure it's recorded by head teachers specifically. There's probably some variation in that across different schools, but it is subjective. There are different categories of absences, so you can start to look at medical related versus not, and unauthorised versus authorised. But there are some, again, differences in how different schools use those categories, and they've changed quite significantly over time. So you see a shift over time in unauthorised to authorised, or vice versa. But yeah, I think the answer is yes, you could explore absences irrespective of illness or not. Yeah.
Okay, excellent, thank you. A couple of sort of non-data questions that have come up as well. I don't know if it's a question or a comment really, but it would be great to have data use guidelines using Stata scripts.
Yeah, at the moment the how-to guides are AMS data. Might need Milagros to confirm that. If the Stata ones aren't available yet, then they're definitely in the process of being. I'm pretty sure we have both Stata and R. But I agree, yeah, we've got lots of Stata users, so yeah, so there will be support there.
Excellent. And another question really around permissions and data access and the contracts.
Yes.
And I think I can probably answer that one a little bit as well, around starting the data access process. I think it's really important to say that if you are successful in the funding opportunity, then the earlier that you can start that data access journey, the better it will be, for exactly the reason that you say, to avoid any delays in the commencement of the fellowship, which is going to be in September of next year. So yes, if you know you're successful, then you need to start working on that as soon as possible. I don't know if Katie, you want to add anything to that?
Yeah, I think get in touch with us as soon as possible, so that we can help you with your application. The other people to talk to are it would be helpful way in advance to check whether your institution has the AOC, the Assured Organisational Connectivity, which is needed to access the SRS. You also need to do your accredited researcher training, which you can do in advance, and you can do it at any point. It doesn't take long, it's a day's training, but you have to wait for the training day to come up within the month and then for your test to be marked. So you can do those things in advance, and then find out who in your contracts team would be responsible for signing the sub-license with UCL, and you can always show them a copy of the sub-license in advance, so that then they know what's going to come up. I believe you might have just said this, Steve, sorry if I'm repeating you, but the first 3 months of the fellowships this time round will be sort of ring fence for sorting out the data access, so you'll have a bit of time at the start of the fellowship to concentrate on that. But yeah, it does take time.
Yeah, absolutely right. Yes. So the first 3 months is kind of built in that, so that you can get that final access over the line. But we would hope if you start it early enough, that you'll be there or thereabouts come the beginning of September next year. So that's brilliant. Thank you.
There's a question about costs there. So just to confirm, we through ADR funding, UCL have created this data asset. So NHS England have been paid to do the linkage and for the data. There are no costs directly to researchers because ADR have supported that and have funded that, and that does include all of the component data sets. But in order to be able to use ECHILD, you've got to make a strong case for requiring the linkage between health and education. So you can't just come and say, can I please access HES and mental health data? You've got to be taking advantage of exploiting the linkage across the different data sets.
Excellent point, thank you. Okay, I think we've got time for one or two more very quickly. So it's a question about someone's currently working freelance on projects but not fellowships. Would I need to work with researchers at UCL to obtain funding? Should I work on preliminary data and then search for collaborators?
I don't know if there's one answer to this. So we have external researchers who don't have any involvement with the UCL team who access eChild, not through fellowships but through other funding. So you don't need to work with the UCL team. That's not a requirement at all. And usually we say, in terms of people who've come to us and asked for whether we can collaborate on a grant application, unless it's something that we're doing already and we're involved with already, then we would usually say we will remain impartial and happy to support you however we can in terms of the grant application, but we don't need to be named collaborators unless it makes sense for us to be. So yeah, hopefully that answers the question. Preliminary data, we don't have any preliminary data, so we don't have any synthetic data, if that's what you mean. So you would have to have a project application approved to be able to use eChild, which you could do if you were applying for a larger grant, you could, if you've got some sort of funding that you could use to do a pilot study using eChild, then that could work.
Excellent. And just on the funding side of things, obviously we are running our fellowships, but there are other funding opportunities available, not just within ESRC, but via other funders. So there are always opportunities to put together projects and seek funding alongside what we're offering here today. I'm going to ask a bit of perhaps a high level question really, and it kind of relates to government missions. So are there any sort of big unexplored questions or topic areas that relate to the government missions that you think the eChild dataset could really be used to answer?
There's a lot of interest from a lot of different government departments at the moment in the opportunity mission around school readiness and what we can do to promote that in order to be able to achieve the goal that's been set of 75%. So I think that is one area that's particularly policy relevant at the moment. There's also a lot of interest for the same reasons, I think, because of the early years focus is around health visiting. The CSDS, the community services dataset, is quite underused because it's very patchy in terms of completeness. But we're hoping that data completeness is going to continue to improve over time, which would allow for a lot more research to be done in that area. And then, as I mentioned, the research agenda for children's social care is another good place to start.
Excellent, lovely. Okay, let's just have one last check and see if we've got one more we can squeeze
There's a
in.
question about success rates. I'm not able to answer that. UCL aren't on the panel for assessing the applications with help with the feasibility side of it, but that's it. It's competitive, I know that much.
Yes, it is. But yeah, thank you for spotting that one. Okay, right. I think any other questions, do feel free to pop them into the Q&A section. As I say, we will compile all these and try and bring them together in kind of an FAQ, which will be published on the flagship dataset webpage and alongside the slides and the recording of this session. And just to sort of tie a couple of things together here that I think you should probably be aware of. Katie mentioned the Community Catalyst research agenda. We actually have a webinar scheduled for Thursday the 13th of November. I'm just going to share this screen so hopefully you can see some of the upcoming events that we have. If I can put it in present mode, that would also help. There we go. Hang on. There you go. So yeah, this one, Thursday, 13th of November, that'll be presented by the Catalyst team. So you can come along and hear about those research agendas that might inspire you in your projects. And to find out more about the nuts and bolts and the technicalities of the actual funding opportunity, so getting your application in and all the stuff alongside that, including data access, we're presenting on the 23rd of October, so do sign up for that one as well. And then of course there are some other HSET webinars that we'll also be running in the coming weeks. And remember that the full opportunity opens on the 13th of November and that runs all the way through to the 26th of February next year. So there's plenty of time for you to work on your projects, engage with data owners and their academic teams, and really put together some novel, viable, feasible applications and get them in before the opportunity closes. So I think with all that, I would like to thank Katie and Milagros for coming along. Really appreciate it. And yeah, there's plenty of information and support sources there for applicants to explore. And yeah, apologies about the gremlins at the beginning, but I think we got through it all in the end. So with that, thank you all very much. And if you do have any questions to Katie or us, you can always contact us with any questions and we'll do our best to help you out. And with that, I'm going to stop recording.